you're going to die because you don't have insurance. That was a scary thought.
I was in beginning stages of congestive heart failure, and so without the surgery I would have died.
I can't afford it here. I'm one of those people who's just out of luck. I'm out of the system.
Kevin, Tom, and Jeff, men left with few options and little time. Kevin's liver was failing. Without a transplant, he would die.
I started feeling really lousy.
Kevin is one of 45 million Americans who don't have health insurance. Many will either not get the health care they need or will need to look to other countries for more affordable care. In the United States, the out-of-pocket cost for Kevin would be $330,000. In India, the cost, $57,000.
I could afford it. So it was like, hey, I can live. I don't have to die.
Tom Hyland also needed a life-saving surgery he couldn't afford. Congestive heart failure was threatening his life.
I probably would not be here today if I had not had the surgery.
Denied insurance again and again, surgery in the U.S. would set Tom back $200,000. In India, the 23-night hospital stay cost him $15,000. The operation, done by an American-trained surgeon.
I said, is this possible that there could be such affordable treatment and high-quality care compared to what we are brainwashed into believing in the U.S., that we have the best medical system in the world?
Doctors in the U.S. are divided on the issue.
Price is not the main mediator of service anywhere, but especially in healthcare.
It may be a reasonable decision if something that you need and you just can't afford it here to have to take the risk.
But is care being compromised? U.S.-based Johns Hopkins now works with hospitals in Panama City and in Singapore. The Cleveland Clinic owns facilities in Canada and Austria. Harvard is affiliated with facilities in India. And it's here a new report by the National Center for Policy Analysis shows the 20-day mortality rate for patients undergoing heart bypass surgery is 0.8%. The U.S. national average is 2.9%. More and more Americans are deciding to go abroad, using medical tourism companies to guide them.
I think that the shift that we're seeing now will continue, where people do not only choose medical treatment outside of the U.S. for cost savings, but also for quality and access.
Wouter Huberex runs World Med Assist, a medical tourism company. Instead of travel agents, his case managers book both the hotel and the hospital, arrange transportation, sit in on clinical consultations, and serve as liaisons between the doctor and patients. Although it's becoming a $100 billion business, Huberex believes there is still room for growth.
The main hurdles are liability protection, and making sure that quality standards all across the world are the same.
No one can guarantee a good outcome, and many countries have no recourse if anything goes wrong. But for many people desperate for affordable care, it's their only option. Jeff Schultz is author of Beauty from Afar, a book about his experience going overseas. A divorced dad with no extra cash and a mouthful of rotting teeth.
I stopped smiling. I had lost my smile.
Jeff did have insurance. It would cover the cost of dentures, but only if he waited for his teeth to fall out.
I joke now. It's like I was kind of bitter about it.
He saved 70 to 80% by going to Costa Rica.
I had a smile again. It was, I really had given up on that, and they gave it to me. I was very grateful.
A feeling Tom and Kevin share.
It's just a great thing to be feeling better every day, and better than I have in well over a year.
I like to say 2.5 years after having mitral valve replacement surgery in India that I'm still kicking and my heart is still ticking.
Overseas surgery, a risky decision for anyone, but for these three men, it paid off. This is Casey Taylor reporting.